and thank you for joining us today for our interview. I'm very pleased to introduce Caryn Millward, and Caryn is a team leader at the Child Safe team for the Office of Children's Guardian. She's here today to share some knowledge and strategies in implementing the Child Safe standards into family daycare services. So a very warm welcome to you, Caryn, and thank you so much for joining us.
Hello, thank you everyone.
My name's Rachel and I'm joining you from Gadigal country. Can I ask where you're joining us from?
I'm on Dharawal land today.
Wonderful. So to start off, could you tell us a little bit more about the Child Safe standards and how they were created?
Yeah, the Royal Commission into Institutionalised Responses to Child Sexual Abuse started in 2012 and ran until 2017. So it was 5 years where 42,000 calls were handled, more than 25,000 letters and emails were received at the Commission, and over 8,000 private sessions were held. There were more than 2,500 referrals to authorities made during and at the end of the Royal Commission. Based on its findings in 2017, the Royal Commission found that the Child Safe organisations create cultures, adopt strategies and take action to prevent harm and abuse to children. The 10 Child Safe standards were developed to provide a comprehensive framework for creating child safe organisations. If you'd like to learn more about the Royal Commission, how it was established and a bit about the process and the findings that they made, we have a podcast on our website, podcast number 1, and one of the Royal Commissioners actually speaks to us about his experience. And also just to add, the Royal Commission also made a recommendation to streamline child protection functions, which meant that the reportable conduct scheme, which was with the New South Wales Ombudsman's Office, was transferred to the Office of the Children's Guardian. That happened in 2020.
So we also know that the Child Safe scheme commenced on February 1st in 2022, and enforcement of the standards started on the 1st of February 2023. Can you describe how the Office of the Children's Guardian monitors services for compliance?
Of course. The compliance team is currently undertaking a pilot program, and they've already visited several early childhood services, including family daycare, to understand what child safe practices look in an early childhood context. To help services like family daycare successfully implement the standards, the OCG is focused on capability building. The OCG compliance team takes an educative, risk-based approach to regulation, which means they focus on areas where there is the greatest risk of harm to children and young people. Monitoring the standards within organisations will focus on how services are implementing the standards to keep children safe, but the approach will not be prescriptive, as the standards are principle-based, which means services have the scope to implement them in ways that best suit what they do. The compliance team may complete a monitoring and assessment of a service to find out if they are implementing the standards effectively. As part of the monitoring and assessment process, the compliance team may direct a service to complete the child safe self-assessment and provide child safe policies and procedures. They would also be expected to engage with the compliance team to discuss the implementation. The compliance team may also complete a monitoring assessment report to help a service improve its compliance with the child safe standards, and the service must respond to the recommendations made in the report. Further enforcement action would be taken if the service was not implementing the recommendations.
Thank you for sharing more about the compliance requirements of the Child Safe standards. I think that's really informative and important for our participants to know. In today's session, we've learned that having a Child Safe Code of Conduct is a vital child safe tool to keep children safe. Can you explain the need for a service to have a Child Safe Code of Conduct?
Of course. As part of the Child Safe scheme, the legislation prescribes a number of documents that a child safe organisation should have. One of those documents is the Child Safe Code of Conduct, which clearly outlines the behaviour and interactions that is acceptable and unacceptable between an educator and children. There are a number of ways a child-safe organisation may design their code of conduct. It will depend on the size of the organisation. Some may have a code of conduct attached to their child-safe policy, and others may have an extended child-safe policy that includes a code of behaviour. However an organisation chooses to design it, a child-safe code of conduct should be short in simple or easy to read English, describing the I wills and I will not statements of educator behaviour, and not use language that could be interpreted in different ways. For example, saying educators should behave professionally could be interpreted differently by different educators. In addition to educators, an organisation's child-safe code of conduct should be shared with parents and carers and children and young people, so everyone in the organisation understands what the expectations are, and also so that they can identify if an educator breaches the code. For example, if a child knows that an educator cannot hit them, then they're more likely to go home and tell their parents. We do run skill builders and on how to create a code of conduct. So if any services need help with that or reviewing their code of conduct, please go to our website, which I think links are being shared, and sign up for a session.
So some of our family daycare educators watching here tonight may be alone with up to 7 children at one time. What advice do you have to them to ensure child safety while working in isolation?
We would advise them to work with New South Wales Family Daycare to make sure they stay up to date with contemporary child safe practices and support.
And some of us here tonight may be aware of the national principles for child safe organisations, but what is the difference between that and child safe standards? And do we need to implement both?
That's a good question. The national principles reflect the child safe standards recommended by the Royal Commission. Both the national principles and child safe standards expand on the types of harm and abuse captured to cover other types of harm and abuse in addition to child sexual abuse, including physical abuse, psychological abuse, grooming, misconduct, and lack of appropriate care. The biggest differences are that the child safe standards are state-based and legislated, while the national principles are national and they're not legislated. That means child safe organisations in New South Wales must implement the New South Wales child safe standards. The national principles, while recommended, cannot be enforced because they are not legislated. The OCG recognises that if organisations are implementing the national principles, then it would be implementing the New South Wales child safe standards.
Wonderful. Thank you so much, Caryn, for taking the time to have a chat with us today. It was so informative, and I think our participants will gain such a great deal of knowledge and insight when it comes to implementing their own child safe standards to make their services child safe.
Great. Good luck, everyone.